Sis, as a urologist, I'm often asked, Doctor, what's the best position to get pregnant? And every time I smile, sis, because I know that behind that question lies so much hope, curiosity, and sometimes even pain. The truth is, it's not just about the position, it's about the connection. It's about understanding how your body and your heart work together to create life. And today, I want to help you see that in the most human, loving, and empowering way possible. Hi, everyone. I'm Dr. Rena Malik. I'm a urologist and sexual health educator, and my passion is helping people understand their bodies, their relationships, and the incredible process of reproduction in a way that's honest, compassionate, and real. Today, we're talking about something many couples quietly wonder about: what's the best sexual position for baby making? I know that for many of you, sis, this isn't just a casual curiosity. It's a question wrapped in emotion, hope, excitement, sometimes frustration, or even heartbreak. You might have been trying for months, maybe years, doing everything right, tracking ovulation, eating clean, taking vitamins, and still every month that negative test feels like a tiny crack in your heart. So when people ask, sis, is there one position that increases our chances? They're really asking, is there something, anything I can do to bring this dream closer? The first thing I want you to know is this conception is a beautifully complex process. There's no single trick or perfect pose that guarantees success. But there are ways to work with your body, not against it, to create the most welcoming environment for new life to begin. The biggest myth I hear is that conception is purely mechanical, sperm meets egg, job done. But your body isn't a machine. It's an orchestra of hormones, emotions, and signals. When partners are tense, anxious, or focused on jetting it right, the body actually releases stress hormones that can interfere with ovulation and sperm quality. So before even thinking about positions, think about connection. Slow down, breathe together. Focus on touch, eye contact, closeness. When you're relaxed and emotionally bonded, your body naturally enters a state that favors fertility. Vaginal muscles relax, blood flow increases, and the hormones that help with conception are released more freely. A couple who enjoys each other without pressure is already doing more for fertility than any chart or manual could teach. You've probably heard that some positions help the sperm travel up. There is some truth there. Positions where the pelvis is tilted slightly upward after ejaculation may allow semen to pool closer to the cervix. The idea is simple: less distance to travel, more opportunity for sperm to reach the egg. However, don't overthink it. The human body was designed for reproduction in many ways, and sperm are remarkably capable swimmers. You don't need to prop yourself upside down or lie still for an hour. If you rest comfortably for a few minutes afterward, maybe with your hips slightly elevated, that's perfectly enough. What really matters is timing intercourse close to ovulation and ensuring both partners are healthy and relaxed. I once had a couple come to me exhausted after 2 years of trying. They had read every article, followed every baby making tip, and still nothing worked. When we did some tests, we discovered both were under constant work stress, sleeping only 4 hours a night and skipping meals. Their bodies were in survival mode, not creation mode. After a few months of rest, better nutrition, and counseling, they conceived naturally. Why? Because fertility thrives when the body feels safe and nourished. So before looking for that perfect position, look at your lifestyle. Sis, eat whole foods rich in antioxidants, maintain a healthy weight, exercise, but don't overdo it. And please talk to your doctor if you've been trying for over a year without success. Sometimes the smallest medical guidance can make a world of difference. Conception isn't just physical, it's energetic. When partners openly communicate their fears and desires, it reduces pressure and increases pleasure. And pleasure itself plays a biological role. During orgasm, uterine contractions can help draw sperm closer to the fallopian tubes. So don't chase perfection, chase connection. Talk about what feels good, what feels intimate, what helps you both feel close. A baby is the ultimate expression of union, and that union starts long before conception. I've seen couples rediscover their relationship when they stop trying and start enjoying. I know how hard waiting can be. I've seen tears in the exam room, late night messages from women asking what they're doing wrong. But the truth is, Sometimes you're doing everything right. Fertility can take time. The sperm and egg need to meet at the perfect moment, in the perfect environment, under the perfect hormonal balance. That doesn't always happen instantly, but it doesn't mean it won't happen. One of my patients once told me we stopped counting days. We just started living again, and 2 months later, she was pregnant. Not because she changed positions, but because she changed her energy. She gave her body space to breathe and her heart permission to hope. So, what is the best position for baby making? It's the one where both of you feel connected, comfortable, and loved, where stress fades and laughter returns, where your body says yes and your heart feels open. The position of your pelvis matters far less than the position of your mind and spirit. When you approach intimacy not as a task, but as a moment of gratitude for your partner, for your body, for the possibility of creating life, something magical happens. Your hormones respond differently, your body relaxes, and nature often does the rest. If you want to boost your chances in practical terms, here are a few gentle reminders. Track ovulation with consistency, maintain a healthy lifestyle, make love during the fertile window, and yes, you may stay lying down for a few minutes after intercourse. Not because it's a rule, but because it allows you both to rest, connect, and share that quiet afterglow of possibility. Remember, intimacy should never feel like an assignment. It's a celebration of love, of partnership, of trust. And when that celebration aligns with biology, life begins. So tonight, if you and your partner are hoping to conceive, don't think about doing it right. Think about doing it lovingly. Let go of fear. Replace it with curiosity and tenderness. Whisper your dreams to each other. Feel grateful for the chance to try again tomorrow, because every attempt is a step closer to that miracle you're waiting for. I'll end with this. Your fertility journey doesn't define your worth. You are whole, beautiful, and deserving with or without that positive test. But I've seen miracles happen when couples combine knowledge with compassion, patience with playfulness, and science with soul. May your journeyed parenthood be filled with love, laughter, and faith. And if you ever feel lost, remember, the body knows how to create life. Sometimes it just needs a little kindness and time. Thank you so much for being here with me today. I'm Dr. Rena Malik, and I wish you all the hope, healing, and happiness your hearts can hold. Good luck, and take care of each other.